Wrinkles, skin discoloration, and acne scarring are just some of the problems that modern plastic surgery can minimize or completely eliminate using laser resurfacing. Dr. Aronson also discusses other methods including Botox and collagen treatments that help reduce the appearance of wrinkles and improve the skin.
Botox is a substance that we place into the muscles of different areas in order to weaken them, and in return we have a relaxation in the area that can help reduce wrinkling and frowning. Specifically, we use it for men as well as women that have a complaint about the frown lines in the area between the eyebrows. We also place it in the crow's feet region around the eyes. It's extremely effective for helping the frown lines in the crow's feet, and we find that it lasts about 3 months, so it requires maintenance. So we feel that the patients that are interested in this type of improvement are extremely happy with Botox. There's many different types of skincare products that are available in the market now. We're carrying several different lines. One of them, MD Forte, has glycolic acid in it. It's very effective for removing the dry, dead skin on the surface and helps to reduce wrinkling and helps to smooth the skin. Obagi is also a popular skincare line to help reduce dark spots of the face. It can also be used on other areas of the body. We have other lines that help to lighten the dark spots, namely things that have bleaching cream in them, and that material is called hydroquinone. So we have several preparations that have the hydroquinone in it that we prescribe for patients that have a concern for the dark spots. Many of the patients after surgery we prescribe or give them certain things to get started with, and it may have glycolic acid in them, it may have bleaching creams in them, it may also have a sunblock. We use Thai Silk, which is a 45 sunblock, and the patients are extremely happy with this. We have several different types of medications that are formulated special for my patients, and they are prescribed specifically for certain types of skin. Because the weather is so dry out here in the desert, wrinkles of the face are a real problem. The patients come in and they're concerned about these wrinkles. We need to examine the patient and decide what's the best treatment for them. In many cases, laser resurfacing is an excellent treatment to help soften or remove the fine wrinkles and soften some of the larger wrinkles of the face. In particular, the little lines around the mouth are a major concern for many patients. And so I usually recommend laser resurfacing to help eradicate those lines. If somebody would just like something a little lighter and not have laser resurfacing, then we talk about filling them with the fillers that we talk about, namely collagen or Restylane. Those are excellent fillers that temporarily help the fine lines. Laser resurfacing is performed in the operating room setting, usually under general anesthesia, but it can be performed under IV sedation for smaller areas, namely areas around the mouth or the areas around the eyes. With any type of plastic surgical procedure, you continue to age. And so people say, well, how long does a facelift last? Or how long does laser resurfacing last? And the answer is, we really don't know, depending upon how fast you age. Usually, laser resurfacing is done once, and then you may need a touch-up years later, 10 years later, 15 years later. But in many cases, it's a one-shot procedure. They may want a touch-up procedure. Namely, they may want the skin tightened, so they may want to come back and have a facelift. They may want to come back and have a little touch-up procedure for their eyelids. But in general, the laser resurfacing does quite a bit to improve the appearance of the face. When we mention the term laser resurfacing, what we're actually doing during the procedure is we're removing the top layer of skin. And this is done computer-generated removal where we're actually vaporizing the top layer of skin down to a smoother level. We can go deeper in the areas that have the deeper wrinkles, and we can go more gentle, let's say, on the cheeks if there aren't many wrinkles in that area. So we tailor the procedure according to what we see at the time of the procedure. During the procedure, there's many decisions that have to be made as far as how many passes we do with the laser, how deep we go, and all these decisions are made with experience. And the experience comes with the number of cases that you do. We started doing the CO2 laser back in 1995 when this particular laser was first developed. And we were the first in the Coachella Valley to offer the ultra pulse CO2 laser for laser resurfacing.